Hello and welcome to the recording of Redesigning Your Phlebotomy Service, Innovating for Capacity, Speed and Equity webinar. Our expert speakers, Katie Moss, founder of Biomoss Solutions, and Richard Wardle, head of pathology at South Yorkshire and Bassetlaw Pathology, explore how to transform phlebotomy services through innovation, automation and improved access. For further free content, please visit www.sbk-healthcare.co.uk. Thank you, and I hope that you find this webinar educational and enjoyable.
So welcome everybody, it's great that we've got so many people on the call today. My name's Katie Moss, I'm the founder and company director of Biomoss Solutions, which is an independent strategic consultancy company which focuses on medical and veterinary diagnostics. And we're here today to do a webinar on redesigning phlebotomy services with a view to looking at how we can innovate for capacity, speed and equity. So I'll just move on to the next screen. So this is the legal boring bit that I've got to say. So I do have to give a disclaimer in terms of the insights and the opinions in this presentation are entirely my own and reflect the independent consultancy perspective of Biomoss Solutions. They do not represent, nor should they be interpreted as the official position, policies or views of my appointing NHS organisation or affiliated bodies. And it's also pertinent to note that I do not advocate or receive financial reimbursements for any supplier or companies that may be mentioned or presented within this presentation. So now I've got that boring bit out of the way, I can give you an update now of what we're going to talk about in my section of the presentation. So I'm going to just give an overview of an introduction to phlebotomy service redesign, look at the role of the patient voice and patient choice and the impact that this will have on any future service redesign. I'm going to outline some innovative models in phlebotomy service. We'll go on then to have a look at some real life examples of innovation within phlebotomy. And then I think it's also important to note then that we go and have just a small outline of considerations of the new world of self-testing that's starting to shape some of our services. Okay, so just the first part then in terms of an introduction to phlebotomy service redesign. So we know that phlebotomy is a critical gateway to diagnostics and early intervention. There are current models that we have in place, the traditional phlebotomy services, that are really facing a significant number of challenges in terms of their ability to provide sufficient capacity. So we've got long waiting times, we've got inconsistent access and underutilised capacity. And so the aim of this webinar today really is to look at how we can redesign services to be faster, fairer and future-proof, and ensure that services are actually in line with NHS NHS goals. The redesign of phlebotomy services was really essential to meet the needs of the patient and the evolving needs. So with that in mind, the current challenges really of traditional phlebotomy services, as I say previously, really suffer from long waiting times in terms of our current capacity. We've got limited appointments, we've got workforce shortages with phlebotomy services, and generally there are a lot of bottlenecks within the service at peak hours. In terms of our equity, the access is really more difficult for people who are in rural or deprived areas who usually face longer wait times or longer travel times to access phlebotomy services. And in terms of the efficiencies in services, there's often still manual booking systems, we might have paper referrals, we've got some fragmented data flows, and all these issues are actually sort of escalating the amount of patient experience and satisfaction that patients are experiencing in terms of it's being played out with long queues, unclear instructions, and we've got inconsistent service quality. So as we look at innovating phlebotomy services, it's really crucial that we are improving the capacity to handle these, to handle the patient volumes and increasing speed in terms of the service delivery. And we also need to increase our equity for access for all patients, regardless of their background. So I think it was because of the 10-year plan has just hit, I think it's really going to be useful that we focus on prevention, integrated care, digital transformation, and reducing health inequalities, and look at how a modern phlebotomy model can actually support some of these priorities and ensure that we've got fast, accessible, and data-driven diagnostics. So how can really a modern phlebotomy service actually help with addressing some of these issues? So I suppose in terms of prevention and early diagnostics, and a modern phlebotomy service can help with ensuring that we get the faster access to enable proactive management of disease. Integrated care, we need to make sure that phlebotomy services are all interconnected, and shared booking and referrals are visible across all elements of healthcare facilities and services. Digital transformation, we really do need to ensure that we've got equity in terms of online scheduling, digital check-in, and real-time data and real-time sample tracking. And then finally, having access to alternative models such as mobile units or home visits can really help with reducing health inequalities and addressing patients within those underserved areas. So I think one thing that I'm really keen in terms of how we can transform services is making sure that we've got the patient voice, but also the patient choice at the centre of any service redesign. And I suppose there's an expectation that phlebotomy services are a linear model in the fact that they are usually delivered through general practice clinics or through outpatient phlebotomy clinics. And patient expectations since the COVID pandemic has really changed in terms of how we deliver services. So lengthy wait times for phlebotomy and diagnostics is no longer an option anymore, certainly for a large cohort of patients who are Generation Z or Generation Alpha. These patients have been brought up in a digital era, often on their phones or smart devices, and therefore their demands in terms of fast turnarounds on decision in several areas of their life is really adding to the fact that we need to start to look at how we can increase our turnaround times, certainly with phlebotomy and diagnostics. And I suppose the question that I'd want to pose to people on the call really is, when was the last time that you really asked your patients as to what they would like from a phlebotomy service? And the reason why I asked that is last year, the Patients Association, in partnership with Roche, interviewed 1,000 patients to understand what their thoughts were around diagnostics and better access to phlebotomy and rapid diagnostics. And 73% of patients wanted clearer explanations of why a test is needed and what it actually involves. And 82% of patients want to seek discussion of different test options before referral. But most concerning is around 34% of patients reported that their physical or mental health declines as they're waiting for tests and waiting to access for tests. 78% would actually travel outside their local area if it meant that they would get faster access to diagnostics and phlebotomy services. 77% are willing to self-test at home, which is something that we probably wouldn't have thought pre-COVID, and 44% would self-test in a clinical setting. So with that in mind, then, how do we actually look at the concept of more rapid access phlebotomy services? And with that, what is actually rapid access phlebotomy services? A lot of people on the call will probably have already got access to rapid access phlebotomy via a walk-in or appointment-based system. They would usually have processes that are more streamlined to try and reduce that waiting time for patients and try and get that quicker turnaround time. And quite often, rapid access phlebotomy, the results are typically referred back to the professional who asked for the actual test itself. And all this then adds to sort of benefits for patients in reducing the waiting times, making that faster diagnostic and treatment and improving the patient experience, and quite usefully in today's climate, reducing costs as well, because we're all financially cash strapped. And so by having rapid access to those services, it means we don't have to have multiple hospital admissions, multiple appointments for blood phlebotomy. So I suppose, what is the ideal phlebotomy services? If we wanted to try and redesign things, what's classed as ideal? And I suppose, as we, some of the things that we've discussed in terms of rapid access, one of the things is point of access. So the ideal situation would be that a patient would receive their phlebotomy and their blood tests at the actual point of access into their healthcare service, whether that's at the same time that they're having a GP appointment, at the same time that they're having an outpatient appointment. That isn't always the case with some patients. And also, it may not be a convenient place as well for the patient to actually have their test and their bloods taken. So we need to look at what would be ideal in terms of a service that's more convenient. Would it be convenient for a patient to have, say, blood tests done that are closer to work? More convenient in that, is it convenient to be able to have your blood test done with your kids in tow? You might have, issues in terms of getting childcare so that you can attend some appointments. One of the other things that we need to consider about an ideal phlebotomy service is looking actually whether it could be painless. Now, about 40% of Americans actually miss some of their healthcare appointments because of the fact that they don't like needles, they don't like having blood taken, and they report that it can be painful. So are there some new technologies that we can do in terms of needle technology to help that process be a lot less painful? The other thing is in terms of rapid turnaround times for your testing, it might be fantastic that we get a really fast phlebotomy service, and then we've got tests, we've got the blood being taken at the point of access, but we also need rapid turnaround times in terms of the diagnostic tests. So things around point of care testing alongside a phlebotomy service would be really an ideal situation for a number of patients. Also, quality sample and the sample of quality and the sample integrity. If we can have phlebotomy services that have got a rapid turnaround with the laboratory, with the actual diagnostic, then in terms of sample quality and sample integrity, that's in a much stronger position. And we also would have the similar workforce training and competencies to enable to make sure that we've got real assurance that that sample is of a high quality standard. And then also an ideal phlebotomy service would have multidiscipline workforce being able to actually provide phlebotomy at the point of access. So not just GPs, healthcare assistants, even scientists themselves actually being able to do phlebotomy services. So if we just go on to then have a look at some real life examples of some innovative phlebotomy services, one of the things that I think we're probably all used to now is the fact that in COVID times, we did adopt quite a number of drive-through models for various different services, certainly around vaccination. And we've also got now services like Richard, and Richard's, I'm not going to steal his thunder at all, but I'm going to let him discuss his drive-through phlebotomy services. But it actually has been really successful in some areas where it's really showcased its effectiveness. And so a drive-through model can really increase patient access because it's more accessible and convenient. So where I talked about having your children come along with you to have your bloods taken, obviously, if you went through a drive-through model, you could have your kids in the back of the car and you can have your bloods taken at the same time. Really convenient. You've not got to disrupt your day, not have to look for parking, etc. And overall, then that really drives that patient satisfaction. So we can help with reducing waiting times and offering convenience through those drive-through models. So along with Richard's model, we've also got an example that's being shown with the Badger unit, which is Birmingham and District General Practitioner Emergency Room. This is a not-for-profit social enterprise healthcare cooperative, and it's providing NHS services. It's a first in its kind in that it's delivering a drive-through clinical model that is offering treatment for minor illnesses that can't be dealt with over the phone. So you can actually see a clinician from the comfort of your own car, and with certain members and certain patients, you may be invited into a clinic room to have bloods taken, etc. But essentially, this is a model that is operating through a booking service. So although it gives you the alternative of a drive-through, it's still a booking service operating in the evenings only between Monday and Sunday, 7 till 10:30. But these are a couple of more pictures of actually, you literally drive through and you drive out. So that's one example where we could look at redesigning phlebotomy services so we can make them more accessible for patients. It's literally sort of like a McDonald's model, so to speak. Another example that I wanted to bring to people's attention is around, and you may be aware of the developments now that are happening in robotic phlebotomy. So this is a concept that has actually now started to be operationalized, certainly in the Netherlands. And it's blood collection, which is fully automated through robot precision. So basically, the patient would sit in the chair there. They would have a ultrasound guided imaging robotic needle inserted into their arm, and the blood collection and the blood draw would happen through the machine. It would sorry, go back again. It helps with maintaining some of the maintaining quality assurance, minimizing errors. And it helps with improving patient tracking and stock management. So these are the types of sort of interventions now that are starting to really eliminate some of the human aspects, I suppose, for some of the phlebotomy services, but also to be mindful that this is one model. I'm not saying that a robotic phlebotomy service would completely overtake the need for human phlebotomy, but it's certainly a model that may be preferred by some patients, but it also could act as a support model for services that are experiencing high demand and having difficulties with access to appointments. So in terms of considering the new world of self-testing, I think we've got to be mindful and cognizant of the fact that self-testing now is becoming a game changer for diagnostics. So phlebotomy services are starting to see now how they can be transformed by microsampling technology. So that is a really cost-effective, non-invasive alternative to traditional models where we would use a dried spot sampling method or a volumetric sampling method. And the advantage over microsampling is it allows patients to actually sample at home. You don't need any refrigeration or special handling during shipment. It's usually less painful and less stressful because it's some small micro needles. And it's starting to really become the superior choice for a lot of services now because they can be performed on those patients where it's really difficult to sort of maintain some of the blood volumes. And then the other thing that I wanted to touch upon is how touch-activated phlebotomy is starting to take a sort of a steer in the market now. So as I said in my disclaimer, I don't advocate any specific companies or solutions, but I thought it'd just be useful for those people that may not have seen the tap-activated phlebotomy solutions, just to watch this 1 minute video, and it can show you how really these types of devices now are enabling patients to actually take control of their own management of care. So if it works, fingers crossed. So as you can see there, those types of innovations are really going to be a game changer for phlebotomy services, but they are a long way off yet. They are being trialled, but it's something to be mindful of as we start to redesign phlebotomy services. So in conclusion to my presentation, I suppose I would just like to say it's really important that we start to tackle some of the challenges with that we're experiencing with phlebotomy in terms of the wait times and the volume of patients that we are having to deal with. When we look at redesigning it, we really do need to be patient-centric and look at what is the patient's preferred model in terms of accessing the service and equity in healthcare service. And then also look at how we can start to embrace the innovation in phlebotomy and look at those types of devices. So how can we actually complement them with a human and a more technological model? So that's my presentation for now. So thank you for listening. So hopefully I've given you a few ideas to think about and a few discussion points, but I'm going to hand over to Richard now, who's going to give you his real life example.
Thank you, Katie. First, I'll just start with saying thank you very much to SBK and Katie for the opportunity to run through this case study. I'll just share my screen with you, so please bear with me 1 second. Right, hopefully you can see that. Okay, so I'm Richard Wardle. I'm Head of Pathology for South Yorkshire and Bassetlaw Pathology, which is five trusts now working together as a partnership to deliver pathology services across South Yorkshire and Bassetlaw. Pleased to see some of our excellent phlebotomy teams joining this call, because in South Yorkshire I'm really blessed to have some really good phlebotomy teams already with us. I don't present this in the capacity though as Head of Pathology for South Yorkshire and Bassetlaw because the case study I'm going to take us through was something that happened a few years ago and was a part of COVID. So it's our drive-through phlebotomy service at the Sheffield site, Sheffield Teaching Hospital. So bear with me a second if I can get it to move on. Okay. So yeah, so it's one of the positives that came through the COVID-19 pandemic. So a bit of background, like I say, back in 2020, I was acting director and manager for Sheffield Teaching Hospitals, and it's under the guise of Sheffield Teaching Hospitals and Laboratory Medicine that I'm presenting this. So 2 hospitals within Sheffield, Royal Hallamshire and the Northern General Hospital. And in March 2020, as we all know, there was approximately, certainly for us, an 80% drop in all laboratory tests because of the pandemic. Due to a number of reasons, reduced capacity for phlebotomy. There was a number of reasons for that: closure of phlebotomy sites, reduced people actually working, patient anxiety. They weren't turning up to the services that were already there. So therefore, that causes a drop in monitoring and a drop in diagnostic tests. So therefore, we knew we'd got sitting at home very vulnerable patients who were at risk of not having their monitoring or diagnostic tests. So trust execs knock on the door, want you to reintroduce phlebotomy. So the requirements that we needed to do: reintroduce a phlebotomy service that allowed social distancing, isolation, that was hygienic with minimal cleaning after venipuncture, high throughput, it was safe for staff. So the model we came up with was drive-through. So to set up and get this underway, we knew we needed an area of hard standing. We knew it needed to be large. We knew it needed to be accessible with good routes by car. And I say car and not vehicle because cars definitely something that we needed to stick with, and I'll come to that a little bit later. Not in use, somewhere that was not in use and available for a significant period. We didn't want to set something up and then have to break it down very soon after. We needed it close to our laboratories. So where were we going to go? Hospital car parks were muted, but staff still needed them. Supermarkets still in use, and they were socially distancing, and a lot of people using them as well. DIY stores, they were always going to come into the be used again pretty soon, and shopping centres likewise. Airports we did think about, but there were none within our vicinity and not really good for use. So this is what we came up with. This is the arena in Sheffield, primarily used for things like this. Events such as Sports Personality of the Year was happening there, big pop concerts, big motor car events, and obviously the Sheffield Steelers. None of that was going to be happening for a significant period of time. So we asked the arena if we could use their car park, and this is what we came up with. This is the first iteration of our drive-through phlebotomy service that we put into place, and that's it from the front. I'll take you through a little bit of the design of it. So it was a 30 by 15 metre marquee set up, like I say, on the odd standing car park of the arena. It had 5 lanes and a storage area to the side, with 5 phlebotomy stations. Phlebotomy stations were made up of a table with electric to them, 4G enabled laptops, so we didn't have to depend upon anybody's Wi-Fi, and ICE order communication system, order system. Sample collection was picked up from the site using a local charity, the Yorkshire White Knights motorbikes. They were only too happy to support during this time of COVID, and it also gave them an excuse to get out of the house, to be perfectly honest. Transport, the trust picked up clinical waste at the end of every day and delivered supplies to us as well. Facilities, the arena were good enough to actually put on facilities for us for staff to use. Staffing, we simply divided our phlebotomy staff from the Royal Hallamshire 50-50. We were still keeping and maintaining the system up at the Hallamshire, but obviously needed to be socially distanced, and we couldn't facilitate the numbers that we were getting through there, so we brought 50% of them down, and we asked for volunteers to do that. It wasn't asking anybody to do anything that they didn't want to do. So we had phlebotomists. We also had stewards, because we knew we were moving a significant amount of vehicles around, cars around a car park, so there was always going to be a risk with regards to that. And we also, for periods of for any issues that came up with it, and let's face it, during COVID, people did lose their minds to a degree. We also had a site manager for some seniority on site. So this is what it looked like in between. These are our 5 phlebotomy stations manned by our phlebotomists, and the cars came through. Unfortunately, it was slow news during that time, so that was a proud moment. I think she's still got that somewhere on this Skype queue box. But this is what we produced for patients. How to use our phlebotomy services. Got it out there really quick to tell people that there was a phlebotomy service and we could use it, and it was with details to actually use it. Not a great picture, apologise for that, but it sort of showed you the how it was going to be used, the entrance point, where the cars came in, they went through the lanes, they went back out the other side, and they drove on and off site. So really quick, really easy. So the procedure was, they were met by the steward at the entrance, they joined the queue of cars, and they were questioned re-symptoms. So if they had no symptoms, they simply joined the queue and went into the marquee at the next available lane. If they were symptomatic, we created the 6th lane down the side of the marquee, donned extra PPE and dealt with them just like we would do any other patient. We positive patient ID using ICE. We found them on the system. We printed the labels there and there. So we have to accept anything, nothing on paper, and everything came through on ICE, except for the odd individuals. At the point in which their labels were printed, they simply wound with the appropriate PPE on for both staff and patient, wound down the window, arm out the window, and they were bled as per usual, leaning their arm on the door. After venipuncture, they were checked if they were okay. If they were okay, they simply drove through the other side of the site and off and home. If not okay, they were just asked to simply sit there and wait until any dizziness or anything like that left and carried on. But to be perfectly honest, very, very, very few had any turns because they weren't simply getting up and out of chairs after, which is usually the case of when people have their turns. And this is it. Simply arm out the car, and one of our guys there is taking the blood. So the site went live in early April 2020, and the first week we took on just vulnerable groups from the trusts only, so the haematology patients, the anticoagulation patients, etc. Anybody undergoing chemo, that sort of thing. By the second week, it was working smoothly, so we opened it to the wider trust. We got more patients coming from other areas to maintain a flow of monitoring bloods and diagnostic bloods. But by the third week, again, it was running so well that we opened it up to the whole of Sheffield City, including GP services. Soon we were reaching 350 plus cars a day, and it really proved a crucial service. So we extended the marquee by two additional lanes, increased the number of phlebotomists on site, and by December 2020, we'd done over 50,000 bleeds. That was the extended site, simply two more on the end. So the benefits of it, the benefits of drive-through phlebotomy, there was a better turnaround time of tests. We were picking up samples from the site every hour on the hour. So therefore, from vein to actually analyzer, in a lot of cases, tests were being put through within 90 minutes. So we had a better turnaround time of tests. Better control of the phlebotomy and therefore the quality. They were our staff, and we knew how they were being taken, and we knew they were well trained and knew all the pitfalls. Patient satisfaction went through the roof, to be perfectly honest. Patients were really happy with the service. One, because they were getting a phlebotomy service that they thought was not going to be open to them because of the pandemic. But not only that, there was added benefits of being able to get something done, turn up without an appointment. It's not an appointment system. It still remains non-appointment at all of our sites. But they could bring children with them, sit them in the back of the car, elderly relatives, bring them in the back of the car. They could bring their elderly relatives to get done without having to park up, pay a fee, and try and then shuffle them through a site and all the stairs and all the complications that came with that. They were simply there in a vehicle, in the car, and taken through. Service satisfaction. Obviously, services were really happy that we could accommodate them and we could get the blood tests done. Not only that, though, they could move to video conferencing, and a lot of them have never gone back, to be perfectly honest. They still use the drive-through service. They still do video and telephone conferencing with their appointments with their patients. So service satisfaction went through the roof as well. Massive increase in capacity from what we had previously, and again, still remains to this day to be the case. We introduced other services to the drive-through concept. So again, at the time, there were patient groups that weren't getting their services through. So the introduction of using it for antenatal checks, for using it for grommets for children, and for vitamin B12 injections, etc., etc. The drive-through concept was used for things like that, just using the same lanes and just taking people through, having one off for a particular service. But in winter 2020, obviously we got concerns for the well-being of staff. The number of daylight hours was decreasing, so therefore there was a decrease in the number that we could actually get through. The use of the arena, they wanted to put events back on. Lionel Richie was wanted to get back out there and do his thing. So we had to move. And do we remove the service? Do we simply take it away? It wasn't there pre-COVID. Was there a benefit to it? Did we really need to carry it on? But there's an overwhelming from patients, from service, from the trust in itself. No, we definitely want to keep this. So it was never a real question. So there's a case for relocation of the service put to the trust execs. We actually did a bit of homework and see where we could rehouse it, and we secured permission from Sheffield Teaching Hospitals to move to an undercover site. But where was this going to be? Fortunately, around that time, Sheffield Teaching Hospitals secured the NHS blood transfusion site next to the Northern General, right next to the Northern General, due to the relocation of the BTS services up to Barnsley. So fortuitously, there was the purpose-built sort of place there. Purpose-built because NHS BT means blood and collection and delivery using a large number of vans, which equals a big garage. And essentially, this is it. So inside here, entrance doors either side, entrance and exit doors either side, and we simply created lanes within there with pull-in bays of which we could do it. It was undercover, so it could be controlled better from the elements. We could get better lighting in there, and obviously it was warmer than being in the wind tunnel of a marquee on a big arena car park. And these are our guys lined up. We have 7, 8, 9 lanes, I think it is, within the site, and obviously we could keep them nice and toasty with regards to heat and heat sources. So in April 21, Longley Lane was taken off of us because they needed it for a vaccination site, as happened around that time. So we secured again another site on the Ring Road to continue with the service. So at that site, we did a quick change to some welfare facilities. We did comms to patient services, local businesses, just to let them know that it was moving there. We altered the logistics, and it was all in place. But by 2023, the drive-through was so in place and entrenched that a business case supported the trust adopt the drive-through as a permanent service. No longer needed BTS, the pre-BT Longley Lane site for a vaccination site. So we moved back to Longley Lane and invested in the site. It became a permanent fixture. So currently, we still run it, 250, 300 cars a day. So even at the peak of the pandemic, we're not far behind that as it stands at the moment. And we still have a thriving walk-in service over at the Royal Hallamshire and some on the Northern General site as well. We've still got a continued control of samples, both from a quality point of view, but also from a delivery point of view. So what does the future hold for the site? So the future certainly is a drive-through service. Continue to develop the site and the service in streamlining it. Katie mentioned McDonald's earlier on, and it's not far from that, to be honest, because McDonald's doesn't have stewards, and we're looking at now the use of signage and electronic signs and what have you to actually move patients around the site. We're looking at developing a walk-in service to work alongside. Not everybody's got access to a car, and it needed to be a car. We couldn't take anybody on motorbikes, which is still the case. Obviously, we don't want anybody tottering up on the motorbike. It's a little bit safer, at least in the car. We can't take anything too big, although we have had things like wagons and stuff go through as well. Community service, we hope to, from the Longley Lane site, develop the need for a community service out of there as well, and have it as a sort of training centre for phlebotomy in the longer term. Phlebotomy is the starting point of everything that we do. I'm head of pathology. Obviously, pathology is our business. We want good results. To get good results, we need good phlebotomy and good bloods, and we're blessed within South Yorkshire to actually have those within our service, but not everybody is trained by our service, so we do want to offer a training facility there as well. Point of care, again, Katie mentioned it. We are using and looking at using point of care alongside. I think the phlebotomy service, the drive-through service, can be a place where people can be signposted to different places. So if you're there, you wait, you get your hemoglobin done at that time. If you're a hematology patient, if it's above a certain level on a point of care device, don't go to the hospital. You don't need a blood transfusion. You can go home today, or something akin to that. So point of care, I think, does have a place within drive-through phlebotomy. And other sites within South Yorkshire. Although I wasn't involved in it at the time, there's a very successful site at Doncaster. Unfortunately, it wasn't supported like the Sheffield site was, but in the future, I really do think there's benefit to bring in other sites on board across South Yorkshire and Bassetlaw to actually to make this work, because it has massive advantages. So just one final thing and one final sort of case study from me, and it shows the benefit, I think, of what this service has. We had all the way through COVID some really anxious people, really anxious patients, and there was a time and a place for it in COVID, and it made a real benefit. And I think everybody was really grateful for that. But it's ongoing. April 2023. There's a Sheffield resident used the drive-through for routine medication monitoring. It was simply a run-of-the-mill routine medication monitoring. 2 hours later, they got a phone call from a haematology reg. They got some abnormal results. 2 days later, they were having a bone marrow aspirate and trophine. And a week later, they got a diagnosis of leukemia and they started chemotherapy. That patient was me. So genuinely, because of busy work schedules, because of everything else, it hadn't been a drive-through, I wouldn't have bothered queuing up and going for a blood test. I wouldn't have made an appointment in my GP to have one, and I wouldn't have gone and sat in a big waiting room waiting for 45 minutes to have it done. It was only because it was on my way to work and I managed to drive through that I actually got it. So it benefited me. Thank you very much. Happy for anybody to contact me after this with anything. Thank you for listening. Over to you, Katie. You're on mute.
Oh, thanks, Richard. So I suppose now is the time really where we hand over to our participants really to ask some of the Q&As. So I think there are a number of questions in the chat box. So we've got a couple of questions that is around what models exist for mobile or home visit phlebotomy services. Don't know if you want to answer that one, Richard. And then we've got what parts of the phlebotomy process do patients identify as most stressful or confusing?
I'll just take I'll take the first bit. We are looking at different models, almost phlebotomy on a. We recognise not all patients have access to or want to come to sites. Even the drive-through, which has a degree of flexibility and hopefully a degree of efficiency around it, that patients can just drive through, because like you said, they're used to the McDonald's drive-through type service. I think now it's time to look at taking phlebotomy to the patient. So we have started the cogs whirring upon mobile phlebotomy and taking it out, almost phlebotomy on a bus, phlebotomy in a van type thing, either direct to a patient's house, because I do think there's a massive role for community phlebotomy and running it out of a central position to places. Again, it enhances the quality of what you get, and you can control it. But also taking it to, if you're nipping into a supermarket for your shopping, why not nip into the bus next door or the room at the supermarket to actually have it get done there? It is about convenience nowadays. And if it's an example like I've just showed you, it might be that one that actually catches that patient.
Yeah, no, I agree with you, Richard. And I think just going to the next question of what parts of the phlebotomy process do patients identify as the most stressful or confusing? I think some of the patient surveys are identifying that patients don't, they want the convenience. They want to be able to know that they could have their bloods taken, at a place of work or nearer to work. They don't have to go to a hospital setting to have their bloods taken, and it's stressful for them because, like you say, from the drive-through, you don't have to go and park, and that's probably something that a lot of patients find really difficult. Go into a car park, going to a hospital, trying to find somewhere to park. Then you've got, you know, if you can't pay with your card, you've got to find change to pay for your car park. And I think that's a lot of the, you know, stresses that people find difficult with the phlebotomy process. And just going, you know, to the fact that the NHS now is moving that left shift towards community-based services, so that there isn't a need for patients to come to the hospital just for some bloods or, you know, for a, you know, an ultrasound or, you know, other types of diagnostics. That is really going to have a really positive impact on patients who, like you say, don't want to come or got a busy life and, you know, find it really difficult. So it's that convenience over actually, you know, going elsewhere and having to take a day off work, etc. So there's loads of questions coming through now, which is absolutely brilliant. And we'll try and answer as many as we can before we finish the session. But one attendee has asked, and I think this is to you, Richard, how did you handle urgent specialist testing? What was your strategy for dealing with time-sensitive specialist investigations?
With respect to, there were certain tests that we knew we couldn't facilitate out of there, and that we do advise that they go to somewhere on a hospital site. But it's very few and far between, to be honest. We still maintain an hourly pickup from our drive-through services, and I would certainly, for anybody that puts anything like that in place, would certainly advise that. So anything that we do have, we can time it so it actually fits with that pickup, and it's a direct to site pickup as well. So they will take samples direct and through. But anything that requires any real special handling, we do advise that it's taken. It's that the patient attends site to actually do it.
Okay. And there's another one there. Yeah, there's quite a few coming on to do with the drive-through. So what key performance indicators were key to catching full support from your trust to fund the drive-through phlebotomy in the business case? Now we know that's a massive issue at the minute, certainly with most organisations and the financial position that they're in. You know, we've got to show that cash release saving and that return on investment. So what are the key performance indicators that you use to get that business model through?
We were pushing on a little bit of an open door at COVID. We did it in a time when I wouldn't say money was no object, but it was certainly a lot easier. So I think we used that period as a proof of concept. I think it was an idea that a number of us had before, but anything pre-COVID, you know, it's probably like anything post-COVID now. It's difficult to get through. We took it as a proof of concept. We did very early into it, and again after a questionnaire with both services and patients in actually capturing their thoughts on it, and it was a resounding positive with respect to patients not wanting to give it up. So that certainly helped. I think there are some financials around it, and it's not financials that are directly. I mean, our reject rate within the laboratory certainly went down. We could prove that our turnaround times were better for patients. We reduced the intensity of patients coming through site, and that probably helped with facilities and having to look at putting extra car parking into, because the way that services were going, they were having to look at exponentially putting on an extra 1 or 2 floors on the multi-storey car park very, very soon, because they simply couldn't get the patients in and on site. The patients who simply come for blood tests now don't have to. So I suppose it's all those around. So not directly cash releasing for the actual service and phlebotomy, but what you can pass on to other places.
Yeah, I'm certainly around like the courier and the transportation aspects of it. And, you know, from a like you've just alluded to, the quality perspective, you know, samples are not sat in GP clinics, you know, not fridged, not put in the correct environment to be stored. You're not having to pay for the transportation costs, because that's one element that I know some organisations have been looking at to reduce the courier costs. And again, you've got that direct link, haven't you, straight into the lab. And, you know, in terms of turnaround, that is just brilliant. And in terms of tracking, I would imagine you don't have many samples that go missing.
No. From a tracking point of view, and to be honest, from an efficiency point of view, we could quite easily put in some booking in stations up at Phlebotomy and have them already receipted and ready to go on to the analyzers and spun down, if we were perfectly honest. But that's the one stage that we've not quite gone to. What I would suggest is also try and tie it into other health care initiatives. So we're working with the local health authority to target taxi drivers as it stands at the moment. We've got a particular problem, I would think nationally, but certainly across Sheffield and I would guess across South Yorkshire, where taxi drivers have really bad, really poor access to health, or they don't access it in the way that they can. We're looking at linking up with local taxi firms to get drivers to come through and almost have, as alongside their car's MOT, their own MOT to actually get done. And there's associated funding with respect to that. So if you can use it to augment your own service, then it all adds up.
Yeah. And when I came to visit the service that you've got, it literally was a few minutes, people were in and gone. It was just amazing to see that. It was really quick. But I'm going to try again. I'm conscious that we're starting to get towards the end of the session, but I want to try and get through a couple more questions. And I'm going to try and group a couple of questions just to get through them. So questions coming through really around, were you able to withdraw some phlebotomy services from elsewhere, and what did you do in terms of increasing your phlebotomy staff on the base to provide the service?
So we didn't reduce our phlebotomy service. I would say that the city's GP phlebotomy services were reduced. I think when COVID hit, the phlebotomy services, certainly phlebotomy capacity fell out of the certain amount of GP surgeries and never really went back. The staff were used for other purposes, other reasons, and it was there to simply carry on and pick up that slack, for want of for a better word. Now, some have brought it back in. So I think as a whole, the phlebotomy capacity across the city is probably about the same. But it's just shifted. So that's a conversation that we're having with, I suppose, the local authorities as to where that needs to work. It was more putting a case to the local authorities that we've shifted this capacity. We need more phlebotomists in there to actually do it. So putting that business case forward to actually get people to come in. We've also extended it, and that wasn't there pre-COVID, to a Saturday morning service as well. So we do run. I didn't mention, we sort of run from around 7:30 in the morning up until sort of 5:30. Both the walk-in service and the drive-through service, but we also on both for a Saturday service as well now. So 8 till 1.
Yeah, no, it is a really good model that you've got, and I'm just conscious now we're running towards the end, but I do really want to pick up on some of the questions that people have put into the chat around some of the other models that we kind of alluded to in our presentation. So the first one is around from Michael Lennox, who is looking at NHS community pharmacy and how we could actually look at mobilising some of the blood testing and phlebotomy services with pharmacy. And I suppose that's something that we've not really touched upon in our presentations, but again, looking at that shift to community, that would be something that would start to certainly increase, I would imagine, as we look at providing increased access to phlebotomy services. And then we've had a message from Vanessa, who's asked about the TAP device that I showed in my presentation, and asked if it's safe to use in neonates. Now, I know that Karen Perkins had actually put in the chat she was using TAP in patients with learning disability. It's become a game changer for them. It's a painless device. So in response to Vanessa, I would probably say that TAP is safe in neonates, I believe. if it's done under strict supervision and the member of staff who's doing it is highly trained. And I think it's probably used in situations where there is difficulty with actually accessing, traditional blood draw methods. And I think that's something that will probably start to increase as well in terms of those, certainly within, as Karen has alluded to, the learning disabilities, so the neurodivergent patients who potentially, it's really hard to get some blood draws from them. That's something that would be a potential solution that services may want to look at alongside the traditional phlebotomy service, because obviously the traditional, in terms of, I'm talking in terms of like the drive-through, should I say, I think those, we need to be offering different models. So we've got a hybrid solution with the traditional, where people are happy to have normal phlebotomy services, a drive-through solution, and then more out into the community with that shift to hospital to community-based services. And I think now, we've got 1 minute left. So I just would like to say, hopefully that you found this really useful and a good opener for some conversations back within your own localities and your own services. And that we, Richard and I are more than happy to answer any more queries or questions that you may have that we've not been able to get round to asking or answering in today's session. But if you contact Lara or Emma from SBK Healthcare, we'd be more than happy to give to either meet you or answer any questions that you put through via email. But we'd really, really like to thank you today on behalf of the team for joining us. And hopefully you can join us for another event that is quite similar in terms of we've got on the 8th of October, there is a delivering point of care testing diagnostic in the community event that's happening in Manchester. So just put that into your diaries as a follow-on event to this.
Perfect. Well, thank you so much to Katie and Richard for delivering such an interesting and insightful webinar. I hope that you all found it really useful.